Central among President Donald Trump's initial policy actions have been efforts to facilitate mass deportation. These policies not only infringe on basic civil liberties, but may also exacerbate shortages of healthcare workers in the United States, given the importance of immigrants to the workforce. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Patricia Mae Santos, an assistant professor in the Department of Radiation Oncology at Emory University School of Medicine. Dr. Santos has co-authored a perspective article about federal policy and immigrant healthcare workers. Dr. Santos, roughly how many U.S. healthcare workers are immigrants? And then what roles do they have in our healthcare system?
Based on recent estimates, so there was a paper that was recently published in JAMA, about 1 in 5 or 20% of all US healthcare workers are estimated to be foreign born. Now, the ranges of percentages vary depending on the role that they have in the healthcare workforce. So, as many as about 29 to 30% of all physicians are considered foreign born, compared to 17% of nurses. But then also about a quarter of all direct care workers are foreign born. So, that's a substantial portion of the healthcare workforce that we're looking at overall.
So, what immigration pathways have historically allowed at least some healthcare workers to enter the United States and stay in the United States?
So historically, there had been various changes in immigration policy in the United States. So at the end of World War II, they had the exchange visitor program, which we highlight in our paper, which allowed nurses primarily from the Philippines to come to the US to obtain temporary workforce visas. And around 1965, this had changed. And actually, they had changed the visa pathways to allow nurses to actually have a pathway towards legal permanent residency through the H-1B program. So that's for nurses, but doctors today have similar pathways through H-1B and J-1 visas. And then there's also the Conrad 30 pathway that actually allows individuals an even more direct path towards legal permanent residency. So it allows foreign medical graduates who have completed their graduate medical training in the US on a J-1 visa to actually have a waiver of a requirement that they have to go back to their home country for 2 years before coming back. But this actually waives that requirement and allows them to actually have a more direct path towards legal permanent residency and then citizenship. So these are all various pathways that different parts of the workforce can take in order to have legal permanent residency in the United States, have work authorization, and then ultimately become citizens.
And then in the past few months, what steps has the Trump administration taken to facilitate deportations and to prevent new immigrants from entering the country, including actions that target healthcare settings?
One of the biggest policies that the Trump administration took on after Inauguration Day was the rescission of the Department of Homeland Security's guidance on sensitive areas. So, what this means is that previously, ICE or Immigration and Custom Enforcement agents were prohibited from undertaking deportation efforts in so-called sensitive areas. So, this includes religious places, houses of worship, schools, university campuses, and also healthcare settings like hospitals, clinics, ERs, etc. But on very soon after President Trump took office, this rule had actually been lifted. So the sensitive areas or sensitive locations guidance had been lifted. And as a result, ICE raids have now been escalated in frequency, but also in the locations in which they're taking place. And that now includes the healthcare settings. And what's really concerning about this lift is that there are now a number of state policies, and we had talked about this in a previous perspective that we had wrote, but there are now state policies that actually require hospital representatives, not necessarily doctors, but individuals at the hospitals to ask individuals what their citizenship status is when they come into the ER to get care. So you can imagine that this will deter a number of individuals who actually need care from seeking it out until the very, very last minute, the absolute most critical minute where they actually need to get care, because they're afraid that their citizenship status or immigration status will be used against them, especially now that ICE raids can and do, in fact, take place in healthcare settings.
That is certainly an effect that these policy actions have had on potential patients. What effects have they had on the immigrant healthcare workers themselves?
We don't know as of yet what the impact has had just because the numbers are so early. But based on the current reporting, what we know is that some individuals who are undocumented have now decided to self-deport or are avoiding the US altogether. And as the data start to come out, and our group is actually analyzing this right now, we would not be surprised if, in fact, there would be a drop in the number of immigrant healthcare workers, whether documented or undocumented, in the case of direct care workers, meaning individuals who are patient aides, home health aides, nursing assistants, what have you. We wouldn't be surprised if there was a drop in those numbers in the year or years to come under this administration. And this is particularly concerning because we already know that based on prior projections of the healthcare workforce and shortages moving forward, we already know that these numbers are going to be dire in the next decade or so. Among primary care physicians, we know that there's going to be a gap of about 27%, up from 18% in terms of the healthcare worker shortage within the next 10 or so years. And likewise, we can see that happen with direct care workers as well. So current estimates prior to the Trump administration suggest that the direct care worker shortage will grow to about 800,000 individuals by 2032. But we expect that given these very aggressive anti-immigrant and mass deportation policies, that shortage will become even greater. And it's going to be very hard for healthcare systems and nursing homes to actually fill that gap because these are not exactly roles that most US citizens are willing to take. So even if we were able to create better incentives, even if we were able to create training programs to increase the workforce, it's not likely to be able to address demand, especially as America continues to age.
You say in your article that federal officials could effectuate immigration reform in a way that secures the border while addressing these potential labor shortages. What would those kinds of reform look like?
I think now more than ever, it's incumbent upon physicians, members of the healthcare workforce, and really on all of us to try to find areas of common ground and bipartisan communication and agreement. And I think one thing that we can agree on is that Americans are getting older. They're going to have greater healthcare needs in the future. And we need to be able to address that, whether or not you're in a red state or a blue state, but especially in red states where there are so many areas that are medically underserved. So recently, actually, I think there was a proposal that was put forth in Congress to actually extend the Conrad 30 program. So this isn't something that we go into very much in the perspective, but the Conrad 30 program and the Physician Access Reauthorization Act, this was actually presented in Congress. And the idea would be to reauthorize this program and expand it to allow more foreign-born medical graduates to practice medicine and to stay and provide care in underserved areas. So even in this climate where it feels like we can't agree on basically anything, there are, I feel, areas of bipartisan collaboration and agreement. It's unclear where this bill is going now, but it has been presented in the House earlier this year. So hopefully we can draw some more attention to this and also potentially change hearts and minds, especially as we start to see the consequences of this play out in our clinics and for our patients overall.
Finally, what steps can clinicians take to help protect and support their colleagues and other healthcare workers who are targeted by anti-immigrant policies?
I think right now we're in this moment where we feel very paralyzed by what's happening. I myself have moments where I feel that way. But I think it's important for us to recognize the individuals around us who are immigrants, who are contributing to the US healthcare system, to direct patient care, and to our society overall, to look around us and to see these individuals and to acknowledge and uplift them. I myself am an immigrant, a naturalized citizen, and a child of immigrants. My parents are healthcare workers here in the United States. They've been providing healthcare to a medically underserved neighborhood for over 3 decades now in New York City. So that is just like my own personal example of how immigrants have contributed. But I think doctors can see that all around them, whether they're immigrants or not, and they can stand up on a one-on-one basis for their colleagues, protect them when these raids are happening, advocate for these visa pathways and programs and public policies that allow legal pathways towards citizenship, work authorization, permanent residency, and then just to speak out in whatever avenue that we can. I'm very grateful for this platform that we've been given, and my co-authors, Dr. Jagsi and Dr. Oronce, have been given here. But there are so many other ways to get the message out, whether it's on social media, whether it's through peaceful protest, or whether it's through working with legislators and getting involved in local policies and the civil process across the United States. So there are many ways that we can kind of stand up and advocate for our colleagues who are immigrant healthcare workers, but also for our patients as well. So I hope that this will empower individuals to take that step, to take that leap, so that we can have a healthier America for all.
Thank you, Dr. Santos.